Hello, everyone. Welcome to Arkansas Connections. I'm your host, Aaron Wallis, and today I'm joined by Andrea Davis from EAC. We are going to discuss tuberculosis. She's going to share important information about TB, like how it spread and what we can do to prevent it. Welcome to Arkansas Connections, Andrea.
Thanks, Aaron. Like you said, my name's Andrea Davis. I work with Engaging Arkansas Communities. I am the Community Health Specialist Program Coordinator. Um, so, just a little bit about what I do is I help clients get testing, but I also provide that linkage to care to make sure that they can get to their appointment and get either further testing or treatment for an infectious disease. Um, so today we are talking about tuberculosis.
Do you have a background in
Um,
TB?
my
Like,
background is in nursing. I worked in a hospital for 22 years. I have taken care of TB patients. Um, I've also dealt with people in the community with TB, latent TB, which we're going to talk about that a little bit. Um, and that's what I've seen a lot as far as in my public health role.
because a lot of people sometimes forget that TB has it's just not it's not a thing of the past. It's still around. And we're actually I know we've seen some outbreaks in Kansas, which to me is very close to home. It's on there's only like one state between
Yeah.
us. So, will you tell us about some key facts that people might not know about tuberculosis and why it is still a major public health concern?
The month of March actually is March 24th is World TB Day. That actually commemorates Dr. Robert Koch, I think is how you say it. It's probably wrong. But he actually was able to isolate the bacteria that causes TB back in the 1800s, the late 1800s. Now, TB's been around long before that, dating back to Greece or way back when. So it's been around for a long time. It is still around. With World TB Day, though, one thing that we should know globally is that tuberculosis is one of the deadliest infectious diseases. Um, the United States has done a real good job of making that not as extreme as it's been, or as it doesn't affect the United States in the highest numbers as it does in the world. Um, so that's kind of something we'll talk about and just go over that stuff today.
So we'll just start simple. How does TB spread? And and you mentioned latent TB. What's the difference between that and just regular
Okay,
TB?
so TB is a curable, preventable disease. I want to say that first. So latent TB is somebody that may have been infected with TB, but they don't have active disease. Um, so they carry around TB in their body, but they don't have active infection. Um, or disease is what they call it. You can't spread TB to other people when you have latent TB, but it just kind of sits dormant. And then if something happens, like say you get sick with something else, or you become immunocompromised, so medications or another illness, then it actually can grow rapidly and you can become not infected but have active disease of the TB. So then you've got this one illness and then you've got another one. It's considered one of the leading causes of death in people living with HIV. So it's very important for everyone, but especially for people who are living with HIV to be mindful of, those co-infections that we hear people talk about. And, if you happen to be around somebody that has a respiratory illness, because that's kind of what TB affects the most that we see. Um, People are kind of doing the things we did for COVID, wearing a mask, covering their cough, because it can be in the air for hours after somebody's sneezed or spit or coughed.
What are some ways that people like a lot of times there's a bunch of myths about how you can spread something. Is there any myths that you hear about TB?
I don't think so. Not from what I've found. And I think that's just because TV's not been a huge thing in the United States. In the 90s, it had become real prevalent. Um, but that's not, 90s was also the time when, um, when HIV was picking up. And so I think those numbers were real huge because of what we were seeing just in general. But the numbers have dropped tremendously in the United States over the years. Actually, in 2020, it's dropped the lowest it's been in decades. Um, and that's mainly because COVID, everybody was in the house. People weren't going out. So, uh,
I know a lot of diseases
yeah,
saw their
yeah,
numbers
infectious
go down.
disease really did. So we've kind of had those numbers come back up. Um, and even in, because I was actually just looking, so even in 2023, those numbers are even higher than they were pre-pandemic. Um, but CDC estimates in 2023 that there was about 10,000, a little less than 10,000 people that had TB in the United States, and compared to the world, where there was about 10 million cases of TB. Yeah, so big,
Mhm.
huge difference in numbers, and that's kind of why I think we talked about the vaccine. There's actually a vaccine for TB. The United States, actually, we don't give that vaccine because we don't have as many TB cases as you might see in other countries to
Mhm.
warrant a vaccine per se. Um, if we continue to have these little clusters like what happened in Kansas, that may change some minds in the future. But for right now, we're not having those numbers. It's more of a world pandemic than it is a United States pandemic at
Mm.
this time. But those cases that they saw in Kansas in January, that's one of the biggest outbreaks we've had in a long, long time, years since the 90s, for sure. But respiratory diseases spread so easily and so quickly. Um, that's why, if you're sick, stay home. Um, if you got a runny nose, a nasty cough, please wear a mask in public. You're not just protecting yourself from getting sicker, but you're protecting other people from getting sick from you. And we should have learned our lesson with COVID, but I still think people just take all that for granted. And just, you should be careful because there is populations that are more susceptible to TB, like we were talking about.
I think it's sometimes because we've gotten so used to things just going our way in a way. We
Yeah,
don't we didn't have the pandemics until 2023. So I've, lived up to like 35 years and just not having to worry about pandemics because you don't think things like that will happen here.
yeah, yeah.
That's true.
And people who tend to be more prone to these types of infections, uh, people that have a compromised immune system, whether that's from cancer like leukemia or head and neck cancer, or it could be HIV, autoimmune diseases where you take immunosuppressive drugs, young children, the elderly, um, people with diabetes, people who are underweight. Um, and the populations that it tends to kind of affect the most, that we've seen in the United States, has been people of Asian, African, or Hispanic and Latino descent. Arkansas has a Marshallese population, and we have seen little clusters and Marshallese speaking individuals in Arkansas. Um,
Do
the
we
other,
know do we know why that kind of
um,
happens? Is it any kind of social or environmental factors that
it's
contribute?
they don't speak English, um, or they speak very little English. The other thing is access.
Mhm.
They don't have the same access that somebody else does, per se. Immigration status might play a key in that. Although I don't think that's huge, but it could potentially play a key. The other thing is anybody underserved. So whether that's because they don't have health insurance or they can't get health insurance, or if they do, they just don't have doctors around. Um, Arkansas has a lot of rural areas, and a lot of times there's one doctor in the area. And if that doctor hadn't seen TB, well, we're talking about, something completely new
Mhm.
to them anyway.
Yeah,
Um,
because it's one thing to learn about it in
yeah,
school and everything, but when it's actually presented in front of you, things are a little
right,
different.
right. The other thing that maybe with the Marshallese is what we're seeing with these clusters is people, large groups of people living in small areas. So we've seen little clusters with people that are incarcerated, recovery centers, nursing homes,
Mm.
where you have a lot of large groups of people living together. The risk of infectious diseases, having an outbreak, they go up. What was the other thing I was going to say? Oh, healthcare workers. So people like myself who've taken care of TB patients, I'm more likely to get TB or come into contact with TB than say, somebody just walking down the street.
Mhm.
But that's where, I use my PPE and those kind of things. Hand washing, the number one thing to prevent infection is to wash your hands, you
Is
know.
there a I know this might sound crazy, but sometimes we need a lesson in it. How long should you wash your hands for?
20 seconds.
20 seconds. Okay. That's
Um,
not it might seem like a long time, but it's not, especially if it's going to keep you
the,
healthy.
the easiest way to count the 20 seconds is sing happy birthday. So one round of happy birthday, and you've washed your hands the right amount of time.
Is there and Germex can will Germex
Yes.
help?
Make sure that it's over, I think 70% alcohol.
Okay.
That's some of the cheap ones will be only like 40 or maybe 60, but you want at least 70% alcohol or higher to kill germs.
Okay. I did not know that. Now I'm going to think I went
Now
and
you're going to read every label.
now I'm gonna be like 70%. It won't kill TB if it doesn't have 70%.
Well, if it's something I bought for work, it's been over
Oh, yeah,
70%.
you're gonna have the hot top shelf
That's
quality.
right.
So, are there any effective treatments or prevention strategies besides, just washing your hands that people can do?
Yeah, so TB is like I was saying earlier. It's a bacteria. It's caused by bacteria. So that means it's curable, preventable, treatable. Um, there are antibiotics that have been developed to kill TB. Now there's not a whole bunch of them out on the market. Um, and they have played around with like combinations where you might take two different types of antibiotics. Um, uh, those antibiotic treatments are for a long span. We're talking like 3 to 4 months. Um, Somebody who has TB disease, it's very hard on you, not just physically, but it can be very hard on you mentally because of the isolation. Uh, a lot of times we'll do what we call direct observation therapy, where you might talk to your doctor or a healthcare provider once a day or once a week to make sure that you're taking your medications.
Okay. See, I had heard sometimes you have to go in and they have to watch you take your medication.
Yeah, that's where the direct observation therapy.
Oh,
With technology, you can do a telehealth visit,
okay.
or sometimes they'll just do a phone call. It really kind of depends on the client. And the reason it's so important with TB is because if you don't take all the medication and you have a resurgence of TB, it can be immune to that first antibiotic you took. Now
Hmm.
you have even less antibiotics you can take. And if you end up with a TB that's not going to be treated with these antibiotics, number one, that can be devastating to our community,
Hmm.
but it can be devastating to you. Um, so they any these days when it comes to TB, almost everybody signed up for direct observation therapy, where you take it in front of somebody, just to make sure that you're taking it.
Well, and sometimes it's not. You life gets busy, and you don't always remember to. I'm guilty of. I'm like, oh shoot, I didn't take my medicine today. Let me take it.
Yeah. But the one good thing about technology is, set a timer on your phone, set a reminder. Hey, take your medicine. That's the good thing about technology and being able to do the telehealth visits or telephone calls as opposed to having to go into the doctor every day because that's not really feasible. And again, rural Arkansas, that's really difficult. Um, and we were talking about latent TB. I want to say one thing about latent TB too is if they find that you have latent TB, it's go ahead and take the antibiotics and get treated. Now, yeah, you can't get anybody else sick with TB, but it's going to prevent you from getting sick with TB disease down the road.
How long can that last in you?
And if it's not treated, it'll be there forever.
Oh, okay.
Yeah, it's
Not
not with it being a bacteria the way it is. It's not something our body can cure. It's
okay.
not like some of these other little nuances like Hep C, where
Yeah.
your liver can magically cure you. And I say magically because that's only 20% of the population does that happen to. Um, and TB's not like that because
So then
again,
it's
it's
kind of
bacteria.
like a silent disease in some way, or it can be because you can go
Yeah,
for a long time not knowing you have latent TB, and then just
right.
something like a switch in your body. Boop.
Yeah, being a healthcare worker and when I worked in the hospital, I got tested every year for TB. But at some point in time, because I was exposed to TB, the TB skin test always came back positive. Um, so that required me a reactive. So that required me to get a chest X-ray to make sure I didn't have active TB. Because obviously I was exposed to it. Now, did they check me for latent TB per se? No, I never had to give a sputum sample where you kind of spit in a cup and they, do a culture on that. So I've never had to do that. But if you don't work in the medical field, you don't get a routine TB test. They don't routinely draw blood for a TB test. And the symptoms of TB are like any other cold viral symptoms, COVID symptoms.
I
I
was
mean,
about to ask, like, how would you know, like, okay, I should probably go get a TB test done?
yeah, it's the cold symptoms. So, you have a cough, you have fever, you're tired. Um, you're definitely going to know you're sick because these
Mm,
people, if once you have the TB disease, you are sick. Um,
okay.
what I've seen that usually sets people apart is people have night sweats, and the night sweats are crazy. You're miserable. The other thing is what you're coughing up. It tends to be bloody. It tends to have blood in it. So it's not like, I blew my nose and I have got a little blood when I blow my nose. No, the sputum looks bloody.
Like, you're going to know something's wrong.
You are. Sometimes in the elderly population, though, and they don't have active TB disease, but they kind of have this lingering cough that's gone on for months, and the doctor's done treated them for everything they could treat them for, but it's still there. So they do a TB test, and it's TB. So then they go ahead and get them on the medication. Um, I went to a TB conference CDC had last September, and there was a lady who got up there and talked to us, and she had active TB at one time. She had a 5-year-old daughter. Um, I don't remember her talking about exactly if she ever honed in on where it came from. Um, but her daughter didn't get sick, thank goodness. But she had to be isolated from her daughter until she finished treatment, so she didn't get her baby sick. And she talked about how hard that was to isolate. Um, that's with active disease. So if you're just infected with TB, the latent TB, you can do the antibiotics and don't ever have to be isolated from your family. So that's one of the good things about those. But if you do happen to get have to be isolated, you know, talk to your friends, get on social media. Like, don't feel like you're all alone in this, because you're not. Especially your healthcare team. You're going to be talking to them so often. You're going to be like, "Hey, I don't want to talk to you no more."
Well, and I know social media and a lot of online things they can be negative experiences, but I do still believe that the social media is a great tool for us to connect, especially if you're at like I have so many friends that are all over the country that sometimes I forget that I can't just say, "Hey, do you want to go get dinner?" Yeah.
Yeah.
So,
Well, and with social media, you can find the support groups with other people that are dealing with the same thing you're dealing with. You know, talk to your family and friends. Let them know. Say, hey, yes, I'm stuck in the house, and yes, I can't visit with you, but bring me dinner. You know, bring me groceries because I can't go to the grocery
yeah.
store. You know, it's very important to stay connected with people,
Mhm.
no matter how you do that. You know, and the good thing, I mean, COVID's not a great thing, but it brought some different things to us.
It did.
Delivery with groceries.
Mhm.
You know, back in the '90s when they were having TB outbreaks, they didn't get groceries delivered. You know, like we do now. So that's the good thing about technology and things advancing.
Well,
So
and depending on where you work, you could still possibly work. So you may just feel like you're working from home, not even realize, you're actually sick.
right, right. Um, so it's one of those things where it can be rough, it can be difficult, but there's also a lot of tools out there that can help you, get through it. And hopefully, if you take some action and talk to your doctor about it, you can get a test for TB and see if you have latent TB and go ahead and get treated for it. Especially if you're living with HIV, that's one of the very first tests you're going to get with all the other blood work that comes along is you're going to get a TB test.
Mhm.
Just like you're going to get the STI testing like syphilis or Hep C, you're going to automatically get those tests as well. Whereas somebody who doesn't live with HIV or get diagnosed, um, they might not ever be tested for TB. So if you think that you've been around somebody with a cough or cold, say, "Hey doc, can I go ahead and get TB testing while you're doing this other blood work? Can you draw that?" The doctor will do it,
I was
but
gonna
you
say,
want to you want to have that conversation
I've never been tested for TB.
that you
So
know of.
that, yeah, that I know of. That
Because
I know of.
doctors do things sometimes that they're like, you know, so
Yeah,
there's good ones out there that will do things
that
like
will do
that.
them. Well,
Yeah.
that's good to know. Well, is there anything else you can think about that we might need to cover about how it spreads or just any important facts?
Um, Let me see. So we had kind of talked about how in the world, there was in 2023 there was like a little over 10 million TB cases. Of those 10 million, 1.25 million of them passed away from TB.
Oh,
In the United States, though, um, like I said, our number was less than 10,000 people with TB in 2023. We actually only had 500, a little bit over 550 people that died from TB.
what would you say? Is that just from maybe lack of care or?
Um, it probably a co-infection is what we'll see a lot of. Like I said, somebody that is living with HIV, your risk is higher there. Um,
So it's kind of like with HIV, how some, a lot of times it's not the HIV that would kill someone. It's that it made your immune system weaken, and
right,
something else is
right,
what
right. Yeah,
caused.
and somebody who takes medications to, suppress their immune system, wear a mask, protect yourself, because not everybody out here is gonna, think
Mm.
about you. So
I
you got to think about you.
I still have, like, I guess maybe a little PTSD from COVID, or that anytime someone's like, "Oh, something's on the rise," anytime I'm anywhere and I hear a cough, I'm like, I'll look, and if they don't cover their mouth, I'm just like, "That's gross." Like,
Yeah,
no.
yeah,
Like, I had COVID once, and I was like, "I don't ever wanna get that again." That ooh. So I can't imagine something worse than
yeah.
COVID.
I I I'm I'm so funny. I have a mask at my desk. I have a mask in my car. I have a mask in my purse.
That's how you know you
Gotta
were
wear it.
that's how you know you were a nurse, though. You're always prepared.
Well, and I have a new grandbaby, and my daughter's big. If I'm sick, if my other kids are sick, I can't go see my grandbaby, which sucks. But I don't want him to be sick either.
True.
So,
Yeah.
we got to protect what people we love, right?
Mhm. And babies are one of the risk factors for,
Yep.
well,
Yep.
for a lot of things actually, because their immune systems are just,
Right. Right.
kind of
They're
building up.
just starting, and you got to build it up, and that's the reason we want to get vaccines. So, a little
Mhm.
plug for vaccines because they do help people. We eradicated polio because of a vaccine.
And measles would have, that's a whole nother podcast. But sadly, there has been one death related to measles in Texas, and it's just,
And it's all because of people that were
yeah.
unvaccinated. Yeah.
I mean, I have no problem. Like, ask all the questions you need to ask your doctor. If you feel like that might be the wrong time to get it, we'll be like, well, I don't know, something feels off. Can we do some, like, if you're trying to protect your child or that, ask all the questions, do everything you need to be prepared. But vaccines do help. You know,
They do. They do. And any healthcare provider that says vaccines don't, find another healthcare provider. Yeah.
because I was very, when I saw measles was on the rise again, I was like, do I need a booster? Is there even a booster for me? Like, I didn't
You,
know, so I started
yeah.
asking questions because
There
I'm very,
is boosters, but you probably got one in college. If you went to college, you had to have one
okay.
to register.
Okay.
So yeah, most of us, because even me, I'm pushing close to 50, but I had to have an MMR when I
Okay,
went
I know
to
I
college.
know I had that shot.
Yeah, and that covers the measles.
Okay, because I
Oh,
remember that the name of that.
yeah, and it might not prevent measles completely, but it
No, but
does make it, a whole lot less worse than what it could
mm,
be. It's just like
that
with the flu vaccine.
see, that's what I always tell people with COVID, it's not gonna keep you from getting COVID,
Right. Yeah.
but it's gonna, like, I felt like one day I was knocking at death's door, and then after that day, I was getting better. I
Yeah.
was like, had I not got that COVID vaccine, I don't know what would, I'm like, I don't think I would have survived. I would have been like, just put me out of misery because it
Right.
was it was bad. I know not everyone had that.
Yeah. I got the
And
flu one time, and I get the flu vaccine every year now. Yeah. Because I just don't want to be as sick as I was that
yeah.
time.
Yeah, I'm very much, if it can be prevented, prevention, staying, like, it is so much easier to prevent than it is to treat.
Yeah. Well, and coming back to TB, there is a vaccine for TB. The United States does not currently give that vaccine, but that because our numbers are really low. But if we start seeing more outbreaks like what we saw in Kansas, that may change. Um, but it's just about protecting ourselves. Doing those things like we talked about: washing your hands, wearing a mask, cover your cough. Cough in the bend of your elbow, those types of things.
Well, thank you so much for joining me. I really enjoyed this conversation. And if you have any more questions, can people reach out to you?
Of course, yeah.
Okay. How would they reach out to you? What's the best way to get in contact with you?
You can email me at Andrea at engagingarkansascommunities.org. Or you can reach me on my cell 479-856-1714.
And you can always contact us through social media, and we'll put you in contact with Andrea.
Yep. Thank
All
you.
right. Well, thank you. And everyone else, thank you. Please join us next time for another episode of Arkansas Connections. Bye, everyone.